Hello, good evening, and welcome once again to Spotlight Endometriosis. And you are here for session 3, where we put the spotlight back on endometriosis. Welcome to one and all, and we look forward to a fabulous evening as we continue to look at ways in which endometriosis has impacted our lives and how we can cope. And my name is Kimmery Richardson Thomas. I'm your host this evening, and I'm very excited to be able to guide you through what we have in store for you this evening. With me, we have our moderator, Bridget Winter, and we also have our president, Amber Grant, along with other members of the TTEA executive. And we all bid you a welcome today. I would like to let you know as we go into what we have in store, we want to jump right into it. Our speaker today is Joanna Landreth Smith. And we are going to be looking specifically at how physical therapy can help you move beyond pelvic pain. So let's get a little bit more about our featured speaker this evening. Joanna Landreth Smith, LPT, is one of this country's foremost practitioners of physical therapy. She is a graduate of the prestigious Nottingham School of Physiotherapy. Ms. Landreth Smith has 40 years experience in orthopedic physical therapy with a strong emphasis in manual therapy skills and the McKenzie approach to treatment of back and neck pain. This extensive orthopedic expertise, along with 17 years experience in the treating of women with pelvic floor dysfunction, makes her the ideal physical therapist to deal with physical pain issues. Trained in Miami and New York, USA, through the Herman Wallace Pelvic Rehabilitation Institute, she uses state-of-the-art biofeedback and pelvic floor electrical stimulation machines at the Aurora Center to treat women with pelvic pain, incontinence, prolapse, and chronic constipation. In 2020, she continued her training in new approaches to prenatal preparation for an optimal birth experience and postnatal recovery, including treatment for diastasis recti. In addition to treating women with pelvic floor dysfunction, she also treats men with prostate problems and pelvic pain, and children with nocturnal enuresis, constipation, and vesicoureteric reflux. In 2021, she completed the Keith Wallace Pelvic Floor Support Systems in Postpartum Recovery, Pelvic Pain, and Prolapse course. She is the first physical therapist in Trinidad and Tobago with 11 years experience with state-of-the-art trigger point drying needling skills in her toolbox, an extremely useful adjunct for chronic pain treatment. She is a member of the Physiotherapy Association of Trinidad and Tobago and currently is the director of the Healing Partners Limited and the Aurora Center in St. James. Ms. Leandra Smith can be reached for any questions and inquiries at 622-4038, and she would share the rest of her contact details with you at the end of this session. I want to introduce to you our speaker for this evening, and before I do that, as she's getting ready to join us, I want to also remind you, I need to remind you, not want to, but I must remind you that the information shared on this program is for general informational and educational purposes only. It does not constitute professional medical advice, diagnosis, or treatment for individuals. So please, please, please consult your healthcare provider if you have questions about your health or before starting any treatment. And with this in mind, ladies, and if we have any gentlemen, I present to you Miss Landreth Smith.
Good evening, everyone. Can you hear me? All right.
Yes, we're hearing you loud and clear.
I am just trying to get my, oops. Can you see my,
Yes, we're seeing your screen.
screen? Okay,
Yes.
great. All right, let me just do one thing here. Still trying to minimize something here. Ooh. Bear with me a minute. I am a techno dummy. So I'm trying to just move things.
It's not a problem.
All right, let's leave that alone. Good evening, everybody. And thank you very much for having me again this year, the Endometriosis Association. I am honored to be here again to talk about the use that physical therapy can be to your people who have endometriosis and who suffer with pelvic pain. Physical therapy can definitely help you move beyond pelvic pain, and we will see why today. All right, so to move on, we're just going to talk about endometriosis. I know everybody knows that it's a painful disorder where the uterine tissue is no longer found inside video. Okay, let me see, sorry, I need to start video. All right. Is that okay?
Perfect.
Okay, sorry. All right. So, right. So endometriosis is a painful disorder where the uterine tissue is found outside of the uterine cavity. It usually is, contained in the uterine cavity. We have a period, we shed, we get rid of the uterine tissue. Unfortunately, the tissue tends to come out into the pelvic cavity and lodge itself on ovaries, fallopian tubes, the uterosacral ligaments, and it has even been found up as high as the lung, all right? Which is not the normal course of things, but this is what happens. And what happens with this uterine tissue when it is there is it does what it does in the uterus, which is that it thickens, it breaks down, it bleeds. And in the extra uterine area, this causes scarring and then tissue adhesions. And our tissues normally slide against one another. And when we have adhesions, the tissues are not able to slide. And this lack of mobility is what causes the pain. In addition to the fact that because we are having pain, we tend to repeatedly and reflexly tighten our muscles in response to the pain. And what happens with this is that we develop shortened and weakened muscles. And these muscles develop trigger points in them. Trigger points are areas of microspasms in the muscle. And because of the tightness, this then affects the joints in the pelvis, specifically the sacroiliac joint, which takes it out of alignment and then produces pain both there in the back, in the sacroiliac joints, in the butt, and referring down the leg. Because one of the muscles that is very closely associated with the SI joint is the piriformis muscle. It is a hip rotator, and it comes from inside of the pelvic cavity, from the inside of the sacrum, and comes out to the to your hip bone, the femur specifically, but what people might understand as being your hip bone on the side, and your sciatic nerve, which is the nerve that supplies the muscles to the leg, passes either above, below, or through that muscle. We're all different. So it could either be above, below, or through. And when that muscle is tight, it presses on the nerve and it causes pain to be referred to these areas. In addition, people with endometriosis can also suffer from migraine headaches. And the reason why they have migraine headaches is because another thing that we do reflexly with having pain is not only curling up into a ball, into the fetal position, where we tighten and shorten our muscles, but we tend to clench our jaw. And when we clench our jaw, we aggravate our temporomandibular joint, which is this joint in front of your ear. And when you have temporomandibular joint dysfunction, excuse me, it brings on migraines. So that's why people with endometriosis can also suffer from migraines, as though, you know, the abdominal pain, the back pain, the leg pain is not enough. No, you also have to have the horrible migraine headache with it. So what are the symptoms of endometriosis? So we know it's pain. It's pain with or after urination, bowel movements, pain with or after sex. And this is all because of the effect of the pelvic floor muscles being tight. The pain is usually worse with periods during your period time, and you tend to have a heavier menstrual flow. Another symptom of endometriosis is infertility, along with chronic fatigue syndrome. Because of this constant, unrelenting chronic pain, you don't tend to sleep and rest well so that your body can recover. So you constantly feel tired and you're not able to sleep and rest well because you're having pain whether you're sleeping or you're up. And another problem with endometriosis is because of the tight pelvic floor muscles, you're unable to have a proper gynae exam so that it is too painful to have the speculum inserted. And you also are not able to use a tampon because it is just too painful. So endometriosis is a long and winding road. There are many parts to it, and it is not an easy fix. As a result of all of this, it can take people 5 to 10 years to be diagnosed, although recently people are being diagnosed a lot earlier so that things can be put in place a lot sooner for them. So physical therapy for endometriosis, what are we looking to do? Our goals in physical therapy for the endometriosis patient is to get them to be able to relax and to lengthen these muscles that are short and tight. We want to make sure that we restore alignment of joints, especially the sacroiliac joint. Our pelvic floor muscles attach to the bones that make up your sacroiliac joint. So if they are short and tight, they pull it out of alignment. And then the pelvic floor then is on a stress, a tension, because things are not in alignment. We also seek to relieve trigger points in muscles. Constant tightening in the muscle develops trigger points, and while massage and stretching helps to reduce it, sometimes we need to do more to relieve the trigger point, and I'll go into that a little later. If there are abdominal scars, we look at mobilizing the tissues to have free movement because that's what we need. We're also looking at down training or helping you to learn how to relax your pelvic floor muscles. We want to set up a daily home exercise program for you, and that is something that you just gotta do every day. We also want to have a cardio component into your exercise program, because we all know that motion is lotion, and when you have that cardiac type of exercise, it releases endorphins, which helps you to feel a little better. You know, it gives you a little bit of a high. And then we need to retrain some basic movement patterns. What this means is that we need to ensure that when we sit, when we stand, the way we move, how we lift, that we do it properly so that we don't put strain on muscles that are already under pressure. And finally, when we are able to get you to control your pain with some significance, then we can start strengthening the core muscles. Weak muscles are muscles that are tight. So even though they are tight, they're not strong because they're tight. Tight muscles are actually weak muscles. And we need to start strengthening them once we get the pain under some level of control. If we look to strengthen without developing the relaxation, we're just going around in circles and we're never going to get any kind of significant relief. We have to get the relaxation under wraps before we start the strengthening, although strengthening has to happen as well, but we have to do it in the right order. So the focus for us with the physical therapy is managing the symptoms, because we all know there's no cure for endometriosis. So we are here to partner with you to help you manage the symptoms that you experience. And so part of this for us has to begin with a proper evaluation. We have to look at what's going on with your back, with your hips, and with your sacroiliac joints. And I'll refer to SIJ as the sacroiliac joint. The sacroiliac joint is the joint in the back where your dimples are above your bottom. It is where the ilium, so our pelvis is made up of two bones that bounce in the front to form a pubic area. And then in the back, it bounces onto a triangular bone called the sacrum. And below the sacrum, we have the coccyx. And those two form the sacroiliac joint. So we need to look at the muscles that work on these joints, because there is some movement that takes place there. And if the sacroiliac joint is out of alignment, then we have a problem with our pelvic floor, because our pelvic floor attaches to the bottom of the pelvic bowl. You know, it comes from the pubic bone in front and it goes to the coccyx in the back. It spreads out to the two bones you sit on, which are your ischia, and they are part of the ilium for the sacroiliac joint. And then we have 3 openings in women. So we have to make sure that the muscles are all relaxed and that the joint is not out of alignment, because if it's out of alignment, then the muscles of the pelvic floor for sure going to be tight. Okay, so we have to look at what's going on with the pelvic floor muscles as well. So after we do the evaluation, if we find that something is out of alignment, we need to mobilize or manipulate the joint to get things level again, because trying to get any kind of relaxation without having things back in their neutral position is a waste of time. You ain't going anywhere with that. All right. So we have you do your warm up, and then we start doing stretches. We're stretching everything around that hip. So we're stretching the muscle on the front, the back, the inside, the outside of the leg, which would be the quads, the hamstring, the IT band on the outside, the adductors on the inside, because the adductors also come up and they insert into the inner ring of the pelvic bone, okay, of the pelvic bowl. And if they are tight, then they're pulling on things as well. In addition to that, we also have to stretch the gluteal muscles, which are your butt muscles, because they affect the sacroiliac joint. And they also need, once we get them to relax and to resolve all the trigger points in there, because 90% of the time they have trigger points if you're having pelvic pain. And if they are not strong, they cannot help to stabilize the spine and the sacroiliac joint. So it makes it easy for the joint to keep going out of alignment. So once we get them stretched, we get rid of their trigger points, then we need to strengthen them. And we also have to stretch the hip flexors and the rotators, because we tend to sit and to sleep and hold ourselves in that flex position, and the hip flexors get tight. So lots and lots of stretching. In addition to the stretching, we teach you relaxation techniques. So if you are not relaxed and you stretch your muscles and you're not allowing them to stay relaxed and to keep yourself relaxed, well, then we're just going round and round in a circle. So in addition to stretching the muscles, we need you to do deep breathing to relax your body. It reduces the tone or the tightness in all your muscles throughout your body. We also teach you how to reduce the tightness in your pelvic floor muscles and the hip muscles. And one of the other techniques that we can use is something called mindfulness meditation, so that you are aware of your body, different parts of your body, different muscles, to see whether they are tight or not. And you learn to check in to see, okay, am I tight? Do I need to relax? And also there's guided imagery as well. So biofeedback is one of the machines that I use to help you to learn how to relax your tight pelvic floor muscles. So you look at the readings on the biofeedback and you will see whether you are relaxed or not, because the biofeedback don't lie. Okay, so even though you may think that your pelvic floor is relaxed, if the reading is above 2 or 3, it means that you are holding tension in that muscle, and you have to learn to bring it down. And then when you are actually able to bring it down, then you look at the machine to see that, okay, this is relaxed, and then you tune into how does the pelvic floor feel now that it is relaxed, as opposed to when you are gripping it and holding it tight, okay? We can also do this on your jaw muscles to help to relax the muscles here where you are constantly clenching, because we can clench without even knowing that we're clenching, because it just becomes so second nature when you have pelvic pain to be clenching. And you need to be able to relax your jaw, let your teeth fall apart so that you are not winding up the migraine headache for it to come on full pelt. So another thing that we do to help relax the muscles is we use a foam roller to roll the muscles, to try to shut down the trigger points in the muscle. So here, the person on the top, she is rolling her iliotibial band or the IT band. We can also roll the muscles on the back of the thigh, which are your hamstrings. We can also roll the muscles in your glute, which are between that bone on the side of your hip and the top, like about the 5 or 6 inches between that bone when you're sitting, and the top of just below your waist, going from this side and rolling all the way back to the sacrum in the back. There are gluteal muscles there that need sometimes to be rolled to relieve the trigger points there. For some people who have pain with sex, we use dilators. So the dilators come in different sizes, and you use these dilators to try to put pressure on the trigger points inside the vagina, which are the pelvic floor muscles, to get them to release and relax. And as they release and relax, then you are able to insert the dilator further until you can comfortably tolerate the dilator that you're using. And then we increase the size of the dilator. Normally they come in about a pack of 3 or 4 different sizes, so that you learn to relax the pelvic floor a little bit more. And then, as I said, there is dry needling. So while massage feels good and it helps you to relax and to de-stress a little bit, and the stressing and the stretching also helps to relax the muscles a little bit and to have more flexibility so that you can move more before you begin to experience pain. And the foam rolling can also help with that. Sometimes there are stubborn trigger points that need to be released with dry needling. Dry needling is using acupuncture needles. As you can see, they're very, very fine. It's not like an injection needle. So we don't necessarily draw blood when we insert an acupuncture needle. And what happens is that when a muscle goes into spasm, it does not allow blood to flow through the muscle. And eventually it uses up all the oxygen that is available to the muscle. And there's no oxygen left when whatever was irritating the muscle, causing it to spasm. There's no oxygen left to allow the muscle to now relax, because a muscle requires oxygen in order to release and relax. So what dry needling does is it forces the muscle to twitch and release. So you will get that twitch, and then the muscle completely softens and it's no longer tender to touch. and some stubborn trigger points require that. So you might need to dry needle the glutes, the piriformis, the hip flexors, the adductors, and even the pelvic floor muscles to be able to get, but you need to shut everything down. Because if you don't shut all the trigger points down, then they just start feeding on one another again. And it's like, you know, the fire just gets fanned. In addition, I mean, this is not physical therapy, but to help with pain relief, you can also use CBD oils. CBD oils can be applied to the abdomen for pain relief. They can also be applied to the vagina and labia, and they can be taken orally to help with sleep, because it's important to sleep restfully and to have 7 to 8 hours a night in order to de-stress your body. In addition, sometimes we have to do some behavior modification. When people are having pain with urination and they're having pain with bowel movements, they may have bladder irritants that are irritating the bladder and causing pain. And that then causes the pelvic floor muscle to tighten up. So we look at eliminating all the bladder irritants. And once the pain comes under control, then we start gradually reintroducing the irritant for you to see whether it is an irritant for you. And if it is, because you see that you either have pain with urination, or you have pain after urination, or you find that you need to go to the bathroom very quickly, very often, and that you don't have large volumes of pee, then if you want to have the bladder irritant, I suggest you have a little bit, you don't have it often, and after you have it, you drink 16 ounces of water to flush it out your system. And you add the bladder irritants back in one at a time. Once we get one thing under control and we see, is it an irritant or not? Yes or no? No, it isn't, then you can add another one. If it is, then you have to learn how to manage it before you introduce another one. You also have to increase your water take and increase your fiber in your diet to make sure that you do not have constipation. We also look at using a squatty potty to change the position of the puborectalis muscle to allow the rectum to be more vertical, so that it gives for easier elimination of bowel movement and stool. And then we look at teaching you, if you have a problem with, you know, stimulating the whole urge and so on, how to do colon massage to mobilize the stool to come down to the point where you can eliminate it. And as I said, we look at decreasing the pull on the puborectalis with a squatty potty. Here's what a squatty potty looks like. So it's a potty, it's basically a stool that you put under your feet to bring your knees up quite high. And you will see on this side here that the puborectalis is not on stretch, and it's more relaxed, so that, you know, the rectum is more vertical. This eliminates straining, and therefore it reduces constipation and eliminates hemorrhoids. Once we get the pain under control, then we have to strengthen the pelvic floor muscles. We need to have good strength pelvic floor muscles to avoid prolapse and also to have a good orgasm. And if you have a weak pelvic floor, it ain't happening. So, but we have to have the pain under reasonable control before we start doing strengthening exercises. In addition to pelvic floor strengthening, we are looking at strengthening the hip muscles, because we need strong hip muscles in order to stabilize the sacroiliac joint, and we need a strong core, of which the pelvic floor is a part, to stabilize the back so that you don't have the back pain. So your core is made up of your diaphragm at the top, your pelvic floor at the bottom, the abdominal muscles in the front, and the back muscles. So we learn how to strengthen the entire core as we exercise. So it's not just about doing Kegels. It's about doing exercises with a core breath so that we do not put the pelvic floor under stress and strain when we are exercising, but we use it all the time during the day so that it becomes a reflex thing as opposed to thinking, okay, I have to do my pelvic floor exercises now. No. But anyhow, regular exercise reduces the estrogen levels. It increases the anti-inflammatory and antioxidant markers, and it just gives better wellness. So endometriosis or no endometriosis, regular exercise is just good for wellness. So in conclusion, physical therapy for chronic pelvic pain is not a one and done treatment. We are here to partner with you in managing your symptoms. We want you to look at reducing your inflammatory load. I know Fadwa is on here. She's a dietitian, and she will be able to tell you, if she hasn't told you already, what are the inflammatory foods that you need to avoid. You need to try to reduce the stress in your life so that the mindfulness meditation helps you to maintain a cool, keep your muscles relaxed. And in addition to that, you need to make sure that you are getting 7 to 8 hours of restful sleep every night. Because if you don't, then your body develops cortisol. And cortisol just ramps up the inflammatory load in the body, and that's just not the way to go. You also need to keep yourself well hydrated so that your kidneys function well, your brain functions well, your skin looks nice and you don't have no wrinkles. And just, because everything works better when you're properly hydrated. It's just good for the balance in your body. And of course, you're going to be having a home exercise program that you need to do every day. And that's just what it is. Okay? Just, hello? Sorry. Okay, so just 2 more minutes and I'm done. I wanted to just go through a case history with you of a patient who I had seen about 4 years ago. When I saw her, she was 40 years old. She had 12-year history of low back and right hip pain. This pain was constant. She had daily spasms in her levator ani, which is one of the muscles in the pelvic floor in the rectal area. So it's literally like having a pain in your ass every day. And this pain increased. So it's there every day, but it increases after she has a bowel movement, which she has every day. And it is especially bad for 2 or 3 days after her period. It is aggravated by sitting and standing for more than an hour. And she had had a myomectomy 4 years before, but with no sustained relief. So when I saw her and I examined her, she presented with a right sacroiliac dysfunction, surprise. And what was very interesting with this patient was that her ilium on the right side was shorter than the left. So she was always going to be having sacroiliac dysfunction because one ilium was shorter than the other. So we had to measure the ilium and we had to see what was the difference that needed to be made so that she could have a sort of a splint made, which she upholstered to slip under her sit bone whenever she sits, so that her sacroiliac joints would be balanced in sitting. So if she had to work, and she did work for like 8 to 10 hour days sitting at a computer, or if she wanted to go and have dinner or go and see a movie or somewhere, she would be able to do it without experiencing pain and then having the pain continue on forever because the sacroiliac joint was now going to be out of alignment until it was realigned. So we got her sorted out with that. And she was very, very compliant with her exercises. But in spite of that, we had to do some dry needling to the glutes, the piriformis, and the coccygeus muscle. And after 2 months, she was off pain medication and she was able to manage, her pain. So if you stick with it and you have someone properly assess you and put you on a proper program and deal with your pelvic floor, both internally and externally, it is possible to get some kind of reasonable relief for what you're experiencing. So that's my 2 cents on treating pelvic pain and how you can come out on the other side of it. Thank you.
Thank you very much, Ms. Leandra Smith. This was a lot. This was a lot of valuable information, and I'm convinced that everyone on the platform, you may have heard an issue that you deal with personally, and if you didn't hear it, you're going to have an opportunity now to raise that issue. But we really want to thank you very much, Joanna. It really was a wealth of information. And I know that the questions have already begun to come in. So at this time, I want to hand right over to our moderator, Bridget Winter, who's going to take over and lead us into our question and answer segment. Yes, Bridget.
Thank you, Kimari. Good evening, everyone. We are so happy that you joined us this evening. And I too want to say thank you to Ms. Leandra Smith for her presentation. As Kimari said, it was a wealth of information and there are a lot of big words in physical therapy, apparently. But before we go into the question and answer session, I too want to remind you that the information shared here this evening is for general, informational, and educational purposes only and does not constitute professional medical advice, diagnosis, or treatment. So please consult your healthcare provider if you have questions about your health or before starting any treatment.
Right. Can I just
Sure.
say one thing? I'm just looking at the chat right now and I see people asking about natural ways and vitamins and HRT. I'm a physical therapist and I'm a physical therapist that sticks in my corner. Does not know anything about vitamins and natural things. I know about exercises and things pertaining to physical therapy. I don't know about drugs. That's for pharmacists and doctors, not for physical therapists. So I cannot answer those questions, I'm sorry to say.
Thank you, Joanna. I actually was going to say that Joanna is speaking on physical therapy this evening, and she may not be able to answer those external questions. So what you can do is we'll take note of your questions, and depending on the other sessions that we have coming up, you may be able to find the answers there, or you can check out a doctor. But Ms. Leandra Smith is speaking strictly on physical therapy this evening. All right. So I don't see any other questions there yet. But what I wanted to find out is, at what point do we come to you as a physical therapist?
Okay, so I know we're talking about endometriosis, but an endometriosis causes pelvic pain. I can see anyone who has pelvic pain because I am not treating endometriosis. I am treating pelvic pain, and I am looking at things that can be responsible for contributing to pelvic pain. So once you have pelvic pain, I have no problem seeing you. I would like you to be cleared by a doctor just to be sure that there is nothing serious, not that endometriosis is not serious, but there's nothing like any type of cancer or anything that could be contributing to this. Not that cancer tends to cause pain, but I don't like to be paying fast and loose with people's lives. And I want to make sure that it is a physical reason for your having the pelvic pain to treat it. And even if you were not to come to me with being cleared by a doctor, after a certain number of sessions, once we are not seeing a way forward with it, I will refer you to a doctor and I will tell you, you need to see a doctor to make sure that, you know, what's going on here. Because this does not seem like something that is very straightforward.
Excellent.
So, you know, what I am looking at is dealing with pain. That's basically what I'm dealing with, is pain and any kind of pelvic floor dysfunction that somebody could have. Pelvic pain is one of the pelvic floor dysfunctions. Constipation, urgent frequency of urination, all of these are pelvic floor dysfunctions that I will treat with. I'm just seeing somebody asking here, what are my thoughts on yoga? Yoga can be very, very beneficial because it's all about stretching and relaxation. So if that's the type of yoga that you're doing, I think it can be beneficial for endometriosis. However, if you continue to have pain and you're not getting any relief, doing stretches without having your sacroiliac joint realigned is not going to work. You need to have it aligned. And once it is aligned and you set off on a program of specific stretches, you can do yoga as an adjunct to the treatment. But as I said in the presentation, stretching alone may not relieve the pain because you may have chronic trigger points that yoga is not going to take care of. But it is very beneficial for reducing the stress and for developing more flexibility. But sometimes, in spite of all of that, you have stubborn trigger points that need to be stuck.
Thank you.
Mm-hmm.
Let me ask a question. I hear it all the time, and I heard you mention it again, that we need to stay hydrated. But there are some people, myself included, the more water I drink, then I spend twice that amount of time in the bathroom. So I have no life if I drink water. It's water and the toilet. How do I
deal with
balance that out?
What we have to do is we have to look at what you're eating with it. Are there bladder irritants in there? When you go to the bathroom, are you putting out a large volume of urine? A large volume of urine is over 8 to 10 ounces. It is not 3 and 5 and 6 ounces. So if it is that you are drinking more water and you are putting out large volumes, and I would urge you to take a measuring cup and to measure it, because some people tell me, yes, I have a lot of urine, I say, okay, well, that's why we do bladder diaries as well. I also do lots of bladder diaries, because when you write it down and you have it in front of your face, it don't lie. All right? If you tell me you're putting out 5 and 6 ounces and I ask you if you think that's a lot, and I tell you, well, guess what? I have news for you. It's not. You should not be having, so when we do bladder diaries, we're looking at every single thing you eat and drink, everything you put in your mouth, how often you pee and what the volume of the urine is. How strong was the urge to pee? We have a 1, 2, and a 3. 3 is get out of the way, I'm going to pee myself. 1 is, okay, I think I need a bathroom. And 2 is, okay, I really need to know where the bathroom is now because I'm going to need to use it soon. I need to know if you had a leak. How large was the leak? What was the activity with the leak? Did you have a bowel movement, and was the bowel movement soft, normal, or hard? That is your bladder diary. In the food, I want to not only know what you ate, I want to know how it was prepared. You put pepper in the food, you had it stewed, barbecued, what fruit you had, Was it oranges, grapefruits, apples, strawberries, juice? Was it a juice or was it a drink? Because you know, juice drinks have plenty sugar in it.
Sugar.
All right. You had a Crix, you had a dinner mint, you had ice cream, you had chocolate. What you had? You know, we need to know everything. So there you learn to see what the bladder irritants are. And that together with when you're peeing and how much you're peeing and how much you drank. You know, so like maybe you drank 16 ounces of water and you felt like you was dying to go to the bathroom and you only peed out 6 ounces. Really? Well, guess what? You did not completely empty your bladder. Maybe we need to do double voids. You know, I had a patient who had that kind of problem, and this was Thursday, and I got to the point because she had back problems, and we got the back to settle down and everything, and she was still having some. Oh, she had had a baby, and she had a 4th degree tear, and she had no perineum after having them try to stitch it up 3 times.
Wow.
Wow, yeah, trauma. So her pelvic floor was weak. And because of the weak pelvic floor, you tend to hold tight, all right? So she's just peeing 6 ounces, 5 ounces, 3 ounces, 2 ounces. I'm like, hello here, but she's drinking 64 ounces a day. And sometimes she would have had 16. I said, you're not emptying. And we're doing double voids, and so she will get maybe another ounce or 2. And we did some dry needling to her glutes and her piriformis. And then she said she had to go to the bathroom. Now she had just peed 20 minutes before, and she was rushing in because she was in traffic and was going to pee herself. All right, so she ran to the bathroom and emptied her bladder. And then we started treatment, and she's like, I have to go. When she went to pee, she's like, all of a sudden, it just like relaxed and it emptied. And it hadn't done that in a year.
Wow.
You know, because we were able to get the pelvic floor to relax, and I had to push. So even though she was doing pelvic floor stretches, where you sit on a tennis ball or you're sitting on a foam roller, it still was not bringing down the tone in the pelvic floor for her to be able to completely empty her bladder. So that's what I'm talking about. Sometimes you just got to get the needle, you know?
Yes.
And you also find when you do it that the back feels a little bit more relaxed, you know, like, okay, this feels a little better. So,
Okay.
sorry,
Wow.
I remember where we were, you know, I could go off on
That's okay. That's okay. All right. So I don't know about the other folks, but I need to start keeping a food diary. But I got a little scared because I have to write down every single thing.
You know, and as like, you know, I always tell patients, I said, yeah, you know, I only eat 1,200 calories a day. Yeah, all right, write it down now, add it up, see where I come up to. Is it 18 or is 12?
Right.
It's the same thing with, you know, when they tell me, yeah, I don't go to the bathroom often. No, 8 and 10 times a day. You think that's right? No, you're going every 2 hours. You're going every hour and a half. That's not normal.
What is normal though?
You should be able to hold your urine for 3 hours, 4 hours, you know? So if you have like 5, maybe younger people shouldn't have to wake up at night to go to the bathroom. As you get older and you get into menopause, okay, maybe once at night, but 2 and 3 times at night, well, then you're sleeping, you know? Sure. And 5 times during the day, maybe. But what I always tell patients and what everybody should do in order to be able to get through the night is just before you go to turn the light off, go and empty your bladder. Even if you went to pee half an hour before, go and empty your bladder, because that gives you the best chance of being able to sleep for the 7 hours uninterrupted, which is what your body needs, because your body needs sleep to rest and repair.
Right.
You know, I just wanted to answer a question I see in the chat here. What is the difference between dry needling and acupuncture? So dry needling uses acupuncture needles. I am looking to get the muscle to twitch and release. With acupuncture, they are looking at a mind, body, spirit change, okay? They might have spirit and mind changes. I don't know. I am not trained in acupuncture, so I don't call myself an acupuncturist. I am a physical therapist, and what I am doing is using an acupuncture needle to get a change in the body. I am trying to get the muscle to twitch and release. Now, a lot of times, trigger points tend to sit over acupuncture points. All right? So it may help the chi to flow. I don't know, because I don't know nothing about chi. And I'm not pretending to know nothing about no chi. I'm not trained in chi. I'm trained in acupuncture. So that's what I'm doing. And I'm looking to see that I get the change that I want in the muscle tissue.
Okay.
Yeah.
We have another question. With respect to pain radiating down the legs from the lower back, is there a particular type of stretching that is recommended for that kind of pain?
Here's the problem. What is causing the pain? Until we know what is causing the pain, we can't say what to do. You have to be properly evaluated. I am not just treating the cause of the pain. I am treating the source of the pain.
Right.
So I could tell you to do something and it could make it worse. It depends on what the source of the pain is. If it is that the SI joint is out of alignment, then I need to realign that first before you do other things. Because you'll do them other things and it ain't gonna be any good, and you're gonna say, that girl, she's a waste of time. She don't know what she's talking about. But she tell me to do this and it didn't work. No, I know what I'm doing. I'm doing this for 41 years this year, orthopedics, and 17 years of pelvic floor dysfunction. And I'm not ashamed to say, I know what to do.
We are happy to hear that. Very, very happy. So it is important to have a diagnosis.
You must have a diagnosis.
Right.
Mm-hmm.
And then once you know what is the cause of the pain, then we could tackle the pain.
Then we can move forward. Yeah.
All right, we have a question from Rhea Smith. With respect to physiotherapy, how long does it take on average to have your SI joint in the right position, and does it vary from person to person?
Well, here's the thing about the SI joint. I can realign your SI joint in one treatment, but then there are precipitating factors that cause it to come out of alignment. So if you continue to do the things that cause it to come out, it will come out again. That's one. So all the things that I tell people to make sure that they sleep with a pillow between their knees, going from their knee down to their ankle, to make sure that they are always standing with their weight equally on both feet. And you know, we like to go side to side, side to side. When you go and you do that, and when you do that, when you have your period and your ligaments all soften up in preparation for birth, that cycle we go through every 30 days or 28 days, sorry, all fall down. It coming out. You also have to look at how you get in and out of a car. You cannot be having sex with one leg down and one leg up. That pulling your SI out for sure, especially if it goes to your periods. All right? I mean, it's real. We gotta be real. You know, if you're going to go upstairs, 2 stairs at a time, it's the same principle. You know? So, and the other thing is, once you get the SI joint back into alignment, you have to strengthen up the hips, because if the hip's still weak, it's coming out again. You have to develop the strength. And some people have to be belted, and you may have to be belted for 3 months for the leg, especially if you come out like way out and you've been out for a long time, the ligament stretches. So you have to wait for the ligament to tighten up again, and you have to be belted to keep it in.
What do you mean when you say belted?
There is a sacroiliac belt that you need to wear, but that only works if the SI is aligned. So if you go and you belt the SI and it's out of alignment, guess what? You're keeping it out.
Yeah. Okay. So, folks, no acrobatics in the bedroom, but on that point, are there positions that are, should I say, that would cause less pain, or that are recommended
Sideline.
for those people who have serious
Sideline.
sideline? Okay, you guys heard that, right?
Mhm.
All right. I wanted to ask as well, I forgot when you were talking earlier about the frequency of urination, you mentioned double voiding. Could you tell us what double voiding refers to?
So double voiding is when you sit on the toilet and you empty your bladder.
Mhm.
Then you get up and you do what my patients call a dollar wine. You move your hips. Yes, I have some crazy patients. You move your hips from side to side, and you go around in a circle one way and you go around in a circle the other way. And then you sit back down, bring your knees up, and try and relax.
Okay.
And then see if more urine comes out. That is a double void.
All right. All right. What is sideline?
You lie on your side, you bend your knees up, and your partner comes in from the back.
All right, and the sacroiliac joint. Joanna, if you could just explain where that is
Yeah.
again.
So the sacroiliac joint. Okay, so you have a pelvic bowl that is made up of two bones that bounce in the front, right? So just above your vagina and your mons pubis, the sort of fatty pad where you have that bone in the front at the bottom of below your stomach, that bone that your hand comes on to, that is your pubic, those are your pubic bones. Everybody must know what their pubic bones are, right? So that bone then comes around to the back. And there is another bone that is in the back, in the middle. It's a triangular shaped bone. It's called your sacrum. So this, I don't know how to do this, and this. So this is your SI joint. And what can happen is it can rotate forward, or it could rotate backwards. It could flare out, it could flare in.
Okay.
That's your sacroiliac joint. Okay?
Okay.
I see
hope
somebody
that
wants me to
answers the
look.
question, Patricia.
My contact is 622-4038 is the contact for Aurora Center. This is for Marsha.
Yes. All right, so if you want to get in touch with Joanna, you can get in touch with her at that number, or you can find contact information for the Aurora Center. And we have dropped her email there as well. Yes. So can you go back and tell us a little bit, especially from my knowledge, biofeedback? It sounds quite interesting.
So biofeedback is a piece of equipment that measures the tightness in a muscle.
Mhm.
So we don't have any international standards for what the strength of a pelvic floor should be. What we have international standards for is what the relaxation tone of the muscle. Tone is the kind of tightness in the muscle that allows us to sit up. So we just don't fall down. Okay, we have tone in our body. We're not tightening up our muscles, but there is a certain amount of stress that's placed on it, excuse me, to keep us upright. That is tone. And when it is relaxed, it should be definitely below 3, and certainly below 2 is even better. When you tighten up your muscle, the numbers will rise. And what is important for pelvic pain patients is to be able to release the muscle and to bring it down to 2.
Okay. So how does the machine know
Because
which muscle?
you have a sensor,
Uh-huh.
a vaginal sensor. So the sensor is placed into the vagina and attached
Okay.
to the machine. Sorry.
I get
that's how
that.
it measures it.
All right. Excellent. All
Now,
right.
if we're doing the jaw, we put it on the muscles right here. We have 2 stickies, electrodes, disposable electrodes. We put it on here and you can see whether you're clenching or whether you have your teeth apart. And the
That-
muscle is closed.
That was really interesting to me in terms of the clenching of the jaw. I have never made that connection in terms of pain and clenching your jaw and the headaches.
Yeah, a lot of people don't. I
Yeah.
work very closely with a dentist who does a lot of work with temporomandibular dysfunction because they tend to also have neck pain. And if they don't get a night splint to get the muscles to relax, we just go round and round in circles and it never settles. But when they do get this, it makes a big difference.
Okay. So we have,
But
That's
that
very
is for
interesting.
nighttime when you're not aware of what you're doing. So during the day, you have to make yourself more aware of whether you're clenching or not.
is this what we call grinding our teeth at night?
Exactly, exactly.
Yes.
Yes, bruxing and clenching. Yes,
Yes.
grinding. And you know, the dentist can see it because they see the wear on your teeth.
Correct. Yes.
But
Okay.
you also
That's
need to go to a proper dentist because everybody is a temporomandibular dysfunction specialist,
specialist.
and they are not. I'm sorry to
No,
say.
yeah.
Yeah.
So
And if
that's
you don't have the proper kind of splint to be used, then you get more trouble than it's worth. And it's
okay.
not cheap.
So, because what my dentist has suggested, because I've begun to grind my teeth, is a night guard. But what is that the same kind of tool?
Yes,
Okay.
yes.
Okay, I never made that connection.
Mhm.
That was a big aha for me this evening.
Dr. Andy Miles is the dentist that I work very closely with because he goes to a temporomandibular dysfunction seminar every year in Chicago.
That's ANDY?
Andy, yeah. Or Andrew Miles, he works in Port of Spain as well as San Fernando. So if there's anybody who needs that contact, they could always get in touch with me and I can give it to them.
Okay, great. I'm seeing another question from Patricia. If you don't have pelvic pain, but have intermittent leaking, what can be done?
Yeah, well, then we have to do a proper evaluation. You probably need to strengthen your pelvic floor. And we also need to look at what the, because if you have leaking, you have weakness. So we need to strengthen the pelvic floor and we need to look at what bladder irritants you are ingesting. So it's a whole process.
Can
You
you
know,
give
I don't
sorry.
do shit in the dark. I look at the whole picture
Mhm.
and I deal with everything. Because deciding to deal with one thing and not deal with the rest of it, and you may not be aware of what are the other things going on, you know, so that's why you need to come and be properly evaluated to get proper results.
Right. And we know that endo is not just one thing. So we have a lot of different doctors working together, you know, to help us manage the pains that we have and the myriad other issues that seem to come with having endometriosis. So it's a holistic thing. And I like that I'm hearing you say that you don't just operate in a vacuum, but you need to see the entire picture.
Yeah.
I appreciate that. So I'm hearing you talk about bladder irritants. What are some of the things that we are considering to be bladder irritants?
Okay, so bladder irritants are citrus, oranges, grapefruit, pineapple, sugar, no sweet, no cookies, no chocolate, no ice cream, milk, caffeine.
Okay, maybe I should ask, what is not a bladder irritant?
you know. Tomatoes, so no tomato sauce, no pizza sauce. If you're having pizza, it needs to be white pizza, no ketchup.
So it
No
sounds like
pepper.
acidic.
As everything that is acidic, because you know sweet turns acidic in the body. So
Okay.
once it's sweet, forget it. None of the diet cokes and all of them kind of things, because the chemical that gives the fizz is a bladder irritant. So no fizzy drinks, no caffeinated drinks. So no coffee, no tea. If you're having tea, it has to be decaffeinated tea, and it has to say decaffeinated tea, not fruit tea. Okay, it has to be decaffeinated tea, because there are a lot of fruit caffeinated black teas. What else is a bladder irritant? Alcohol, curry, pepper, all the good food.
Yes, yes. So Ria says everything she loves. And our darling president, Amber is saying she knows. So Fadwa, I don't know if all of you know Fadwa. She is a dietitian.
Yes.
So she's probably saying, yes, I told you all. So really, it is all the things we know we shouldn't be eating. And sometimes we just need to take a little taste, and it throws things out of order. So,
and the thing about it is, when you begin, once you've identified something that is a bladder irritant for you, I'm not saying that you can't have it and you must never have it. What I'm saying is, if you're going to have it, do not have it for breakfast, lunch, and dinner. Do not have it Monday, Wednesday, Friday. Have it maybe Monday and Friday.
Right.
And have time in between where, and so don't have one irritant Monday, another irritant Tuesday, another irritant. You know, don't do that. Pick the two that you're dying to eat.
Right.
And have it once for the week on a Monday and one on a Friday, you know, and see how you do with that. And then gradually add them until you see, okay, I'm carrying a story too far now, I need to back off.
Right.
You know? But the first thing you have to do is you have to clear everything. And then you can start figuring out what are your bladder irritants, because what is a bladder irritant for you is not necessarily a bladder irritant for me.
Right, that is so true. I am seeing Rosalind asking a good question. I like her question. What about the opposite? What are some foods that can calm our bladder?
I don't know. Speak to the dietitian about that.
So for those of you who don't know, Ms. Fadwa Abdul Ghafoor, she is part of our executive. She is a dietitian. Fadwa, if you can maybe drop your number there so that people can contact you. And we also have a support group that Fadwa usually contributes in. If we will ask the host to drop the information for the support group before we leave this evening, you can join the support group there. But I want Fadwa to drop her number there, and I want us to tell you a little bit more about the support group. So you can go there where people share about what they are trying, what works, what is not working. You know, it is a support group. So you can ask your questions there as well.
And everybody is different.
Correct. And everybody's body reacts differently to different things. Yeah, that is so true. Sorry, Miss Frederick. It's not intended. I meant to get back to you. That is your question about endo cannot be cured. Yes, we say that it doesn't really get cured. What it gets is managed. And let me read your question. From the inception of being diagnosed, it was said that endo cannot be cured, and it was repeated by the presenter tonight. What is the evidence behind this pronouncement? Is it just a matter of time for discovery, like other chronic illness, that over time a procedure or cure has been discovered? So the first thing is, and I'm not a doctor, remember our disclaimer, everything we say here this evening is for general educational purposes. The fact that they have no idea what causes endometriosis means that they also don't know what the cure is. So what a lot of people do is, based on the surgeries that they have, or whether it's physical therapy, change in diet, they learn how to manage the symptoms. Some people get long periods of remission, and sometimes it comes back, so that even after you've gone through menopause, a lot of women still have endometriosis symptoms and pains. So those are some of the reasons why it is said that endometriosis is not cured. I do not know if Joanna wants to add anything there.
Sometimes we just don't know until we know. And endometriosis is one of those. It is a recent diagnosis as well. It's not something that has been recognized. Now, it has been around, but people have not recognized it. I am looking here at someone saying that they've been to the doctor with severe period pain and never heard the doctor talk about endometriosis. Now, who is this doctor? Is this a GP? If you are having severe period pain, you need to be seeing a gynecologist. One, not a GP, because a GP don't have the first clue of how to diagnose endometriosis.
She's saying it is a GP.
Right. So, sweetheart, you really need to go and see a gynecologist. GPs cannot do everything, and that GP should be referring you on to a gynecologist. I don't know whether he has, and you have not chosen to see a gynecologist, but you should be seeing a gynecologist for more than one reason. A gynecologist needs to be doing your pap smears, and you need to have a pap smear every year. GPs should not be doing pap smears. So go and find a gynecologist and let them have a look at you and what's going on. And if they can't give you a reasonable diagnosis, go to another one.
Right.
And I seriously recommend you going to see Brian Brady.
Okay. So you had you have a name there, but I also want to suggest to some of you is that you bring up the possibility to your gynecologist. Doctor, I have been reading up on this. Is it possible that I have endometriosis, and can we check for it? You need to advocate for yourself. So if you think you have it and the doctor does not bring it up, there's nothing wrong in bringing it up to them and ask them if there's a possibility and if they can check to see if that is the reason for your pain. So I'm seeing Anissa is saying the same thing. She saw a gynecologist for years and he still did not diagnose her with endo. And that is the case of most women, I believe, in this session here. It took me 30-something years of suffering. And I worked for an insurance company and I saw the term. I was like, wow, this is exactly what I have. And I went to the gynecologist and said, hey, I have endometriosis. What can you do? So sometimes you need to bring it up to them. And sometimes, our host is saying that she told her doctor that she had endo and he still doubted her, but he recommended her for the screening and the surgery confirmed it. And so if you are going to a doctor who is not listening to you, go to another doctor.
That is it exactly. And Amber is right. This is not, we're not special in this country that we don't get properly diagnosed.
True.
On average, it takes patients up to 8 to 10 years to be diagnosed. I don't know.
And that's the lower end of the scale now.
That when we tell you we having this pain and how terrible this pain is, I don't know if it is, and this is especially for male gynecologists, and it irks me when it is female gynecologists, because I feel you are female too. Okay, you may not be suffering from the same level of period pains that I am having, because I'm an endo suffer as well. Okay. But you should have a little bit more empathy for me, because this is real.
Yeah.
You know, but yeah, you have to advocate for yourself. And, Brian Brady is, I think, the person to do your surgery here in Trinidad if you have to have surgery, because it's the next story. You want endo surgery is like really specialized surgery. You want somebody who is going to be very careful, because we're talking about scarring, and surgery causes scarring as well.
Mhm.
So you want somebody who is going to be like a plastic surgeon in there with the way that they do their surgery, so they don't cause more problems.
Right.
I mean, I'm advocating for Brian Brady for a reason, because, darling, you have enough problems and you don't need anybody giving you more problems. And he is, I think, the best endo surgeon that we have in this country. And he works in Borders Bay in general too.
Okay. So Patricia and Anissa and anyone else who may be having the same problem, if you do not have a diagnosis, but you are still suffering, perhaps change your doctor and see someone who is at least willing to listen to you and work with you to figure out what is causing your issues, because it may not be endo, we can't say, but at least you have a doctor working together with you to help you figure out what the problem is and what the problem could be.
Yeah.
So Joanna has given you all a suggestion of an endo specialist that you can see, and there are others. However, we are not in a position to recommend surgeons to you all, because different things work for different people. The same with the doctors. So you have a suggestion from Joanna, who I did not know also had endometriosis. So it is hard. The pain is a killer, but find a doctor who is willing to listen to you. If the one that you have is not listening, try another one and keep trying until you find a doctor who will listen to you. Yeah.
I want to just say something to Ms. Fredericks, who just made a comment that she doesn't want to think that management and support is the end of the road for us. I'm not trying to be negative when I say that. I'm trying to be realistic. We definitely want to know what the cure is. I'm not saying that we don't want to know what the cure is for endo. What I'm saying is the reality right now is that there is no cure, and that the way forward is looking at managing your symptoms, so that you need to do what you need to do for yourself on a daily basis. So I'm not negating the fact that we will never find a cure for endo, but what our reality is right now is we don't have a cure. We don't have a cure in Trinidad. We don't have a cure in America, not in Germany. I don't think in China or anywhere in Europe or anywhere in the East for endo. That's just what our reality is right now. Hopefully we will find what causes it. It may be a hormone or something, and maybe they will be able to eventually give you an injection that will stop something from happening. Who knows? I don't know, but right now the reality is that you have to manage your symptoms, so, and it is just for you to be realistic in when you come to physical therapy, that you recognize that it's not like it's going to finish. It is that I am trying to help you to find a way to be able to live with it and have a life. That's what it is.
Thank you, Joanna. And Ms. Frederick, we feel your pain. And also, it doesn't mean that there are lots of ladies who are living with endometriosis and they don't have pain anymore because their surgery has helped. But it's just that they don't say you are cured, because we don't know what will happen.
Because
so
it's back.
Correct, but they are living without pain. So it's not that you are going to be in pain for the rest of your life, right? So we do hope that you find a doctor who can assist you and that you get relief. And we are here to support you if you need it. So we thank you so much for participating this evening and for all your questions. And I want to say a special thank you to Ms. Landreth Smith for sharing with us this evening. And I am sure maybe you're gonna see some of the people who were here this evening. And we thank you so much for giving of your time and sharing the information that could help some of us manage the issues that we are having as a result of endometriosis. And we thank you for always supporting the TTEA, the Trinidad and Tobago Endometriosis Association. At this time, I want to hand you back to our hostess for this evening, Ms. Kimmery Richardson.
Thank you very much, Bridget, and thank you as well again, Mrs. Landreth Smith. Thank you to all of our participants. And as we wrap up, on behalf of the Trinidad and Tobago Endometriosis Association and the executive, we want to thank all of you for being a part of session 3, Spotlight Endometriosis. We want to encourage you to visit the TTEA, our Facebook page. You will be able to get a lot more information and you'll be able to connect with members of the executive and members of the organization. Remember that TTEA is here for you, and that's one of the things that Bridget just ended with. We are here for you. It's about the advocacy, and you also need to remember to advocate for yourselves. We're also encouraging you to make sure at the end of today's session, get medical advice. This is the doorway. Tonight was the doorway that allowed you, that facilitated the kinds of questions that you can take back to your medical providers, to your doctors, your medical practitioners. You are now equipped with a bit more landreth so you can get back to them. Remember to manage your symptoms. And I also want to encourage you, Ms. Landreth Smith, Ms. Landreth Smith had mentioned it, and I want to remind you, get your pap smears done every year. Get your pap smears done every year. Ladies, and if we had any gentlemen, thank you. And we look forward to seeing you for our next Spotlight Endometriosis. Good night.